Hey, what up? It's Persia Nicole, and I want to welcome you back to the virtual Why Women Cry conference series. I hope that you all enjoyed session number one. It was so amazing, right? Yeah, generations loving, listening, and living, and it is only going to get better from here. Let me tell you this, get ready for today's session and turn your life all the way around because that is exactly what's going to happen. You know, fibroids, preeclampsia, and hypertension are hard-hitting issues that can impact our joy, our health, and our overall well-being. So today's session will help you address your concerns and questions during women's health. My womb, my power, my love. That's being moderated by Randy Woods. She will also introduce our panelists who are experts from areas and the fields of public health, along with special guest artists that I know you want to see, honey. Yes. The Why Women Cry Conference series is not just about surviving, but it's about thriving. It's not just about making it, but of course, by making it happen. Yes. It's not just about getting it done, but also, really dancing in the face of fear. I said it before. Don't nobody got time for that? This is an all call, ladies, for those who want to live with passion and purpose, to step up to the table. Make your presence known, honey. Let's make history around here. This is our moment. This is our movement. This is our magic. Make sure you register right now on Eventbrite. Make sure you are there, okay? So you can be maybe this week's a lucky winner. Okay, then. Only those that are registered stand a chance to make sure you do that again at Eventbrite, okay? Stay tuned and, of course, gain some knowledge, wisdom, and wellness. And make sure you bring another sister with you and share this button so everybody can be a part of this that needs to learn, live, and laugh. This is Why Women Cry 2021.
Good morning. Thank you, Persia, for that awesome introduction for this day's panel. I actually am awed by Persia. She is just stunningly beautiful, and she always is just on point with her words. I wanted to come on just before we introduce Dr. DZIRASA, and before the panel gets started, I wanted to come on and welcome you and thank you all for continuing to be steadfast with Why Women Cry each and every year. We got bumped on last year, but we're back again this year. And I wanted to stop in to say and to remind you that there is no passion to be found playing small and settling for a life that is less than the one you are capable of living. Nelson Mandela couldn't have said it better, and I'm saying it now to us as we walk in our purpose and our passion, and we walk without fear. We dance in the face of fear. We develop a passion for learning about our minds, our bodies, and our spirits that help us to lock in to our divine purpose without fear, that brings us great joy, even in the midst of darkness, and we will never cease to grow. If you remember this, remember, no passion, no purpose. No purpose, no passion. As well as that we do not do either of those when we're fearful because we are almost out of it. That's what I wanted to leave you with today. And I wanted to just say thank you, thank you, thank you for your continued trust in us to bring you only the best. We have an awesome panel as we had last week. We have another awesome panel this week. And so without further ado, I want to turn everything over now to Dr. DZIRASA, our Baltimore City Health Commissioner. And I want to say thank you, Dr. DZIRASA, for being a part of Why Women Cry. Thank you to all of you, and especially to our upcoming moderator and panelists. Thank you so very much. Have a blessed and beautiful day. Enjoy this session.
Hi, my name is Dr. LETITIA DZIRASA, and I am the Health Commissioner for Baltimore City. Before we begin, I'd like to take a moment to highlight the importance of Why Women Cry and events like it. Critical conversations like these happening in our community about issues that disproportionately impact us and those who look like us are the ultimate drivers of change. And it's together that we can promote lasting healing and wellness. Thank you to the women that have made this event possible year after year. And most importantly, thank you for being here, albeit virtually. But even with this year's conference being held virtually, just by being here, you're demonstrating a commitment to meeting the needs of your community. Thank you for having me this year. It's truly an honor and a pleasure to be here. Why Women Cry was one of the first events I ever attended as the new Health Commissioner in April of 2019. So while this is not my first Why Women Cry conference, this year's theme, Purpose and Passion, Dancing in the Face of Fear, makes this one perhaps the most important to me. Because if the COVID-19 pandemic could be described as anything, fear of the unknown would certainly come to mind. For those that don't know me, I actually hate public speaking. Early on in the pandemic, I felt so much anxiety leading up to every press event. So when I found myself tasked with discussing race, an uncomfortable topic to say the least, I was nervous. It was one thing for us to post the data online, but it becomes something entirely different to have a critical discussion around what those numbers mean for people. The anxiety around having these critical conversations persisted. But as the year went on and news cycles continued to worsen, I found myself struck by the constant, senseless murders of people that look like me and my boys. The murders of Ahmaud Arbery, Breonna Taylor, and George Floyd, just to name a few. It was the ending of their lives and the silencing of their voices that sparked outrage. As a mother of 2 Black sons, a freshman in college, and a precocious 4-year-old, I was and continue to be afflicted that anyone could murder my 2 boys because of what they look like. So in my pain and fury, I had to overcome the anxiety around public speaking so that I could try to be a voice for those whose voices have been silenced. As a public health professional and the health commissioner for Baltimore City, it became necessary to talk about race and to talk about why Black people are 3 times more likely to be hospitalized and 2 times more likely to die from coronavirus. If we want to address institutional racism contributing to health disparities, we must start by having the hard and uncomfortable conversations that will last well beyond this pandemic. Awareness and understanding can help drive change. We can't begin to come about solutions if we don't acknowledge the root causes of the issue. Education and conversation can provide the foundation on which we can build long-lasting solutions together. This past year, we saw communities rallying behind each other. We saw groups rise to the occasion. And while our sense of normal was disrupted, every single day, we have the opportunity to examine what we have the power to change. I urge you, be the change that you want to see and build each other up along the way. That, to me, is the foundation for which lasting communities are built. And by being here today, you've already taken those first couple of steps, a willingness to listen, learn, and collaborate. My hope for all of you participating in today's conference is that you hear something that inspires you to learn, empower, and connect, and then you act. Thank you.
Good morning and welcome to everyone out there. I give you a great hug. I am Randi Woods. I'm a part of the Why Women Cry Planning Committee, and I am just so excited to be moderating this panel today and to be coming and joining in the Why Women Cry conference, the 15th, 16th year. And this is our first virtual edition. And so today we are going to continue with our theme, as Dr. DZIRASA said, we have to continue to move in our passion and move in our purpose and use our voice, right, for the voiceless and to bring power and liberation to our communities. And so today we are going to be discussing women's health. We're going to be talking about our womb, our love, and our power. And so I want to make sure, last week, if you joined in, I was a part of the generations panel, and I said, I love to listen, right, and get inspired from people and get informed from people to move me into action. And so today I'm so excited because I'm going to be on a panel and moderating a panel with 2 brilliant experts in their field. And so with that, I want to make sure that you share this because we're going to be talking about the continuum of women's health. I want to make sure I make that clear that it's Black girls and women, as the Why Women Cry conference was birthed out of the need to really focus on the Black girl and women's health, right? And so today we're going to get into the crux of that. So I want to make sure that you hit share with your sister, your mother, your daughter, your auntie, all of your girlfriends. They should be joining in today. So please go ahead and hit that share button, and then make sure that you have your pencil or your pen and some paper, because you need to take notes, right? In order to go into action, you're going to learn a lot of things today. We may say some things that you might want to research for yourself. So without talking about me anymore, I want to introduce our panelists who will be joining us today. And so here to talk about our womb, our love and our power with me is Dr. Yvonne Commodore-MENSAH. Okay, and Dr. Yvonne Commodore-MENSAH is an assistant professor at the Johns Hopkins School of Nursing and the Johns Hopkins Bloomberg School of Public Health. She is also faculty at the Johns Hopkins Center for Health Equity. As a nurse and cardiovascular disease epidemiologist, her program of research seeks to reduce disparities in cardiovascular health among African descendant populations locally and globally through epidemiological and community engaged methods. And next we have Dr. KHARA Simpson. Dr. KHARA Simpson graduated from Hampton University in Virginia, followed by medical school at Howard University in Washington, D.C. She shares the alma mater of our vice president. And so, woohoo, I love HBCUs, and was inducted into the Alpha Omega Alpha Honor Society. Following, she completed her residency at Johns Hopkins, where she served as an administrative chief resident. She then completed a 3-year fellowship in minimally invasive gynecology at Columbia University, with 1 year dedicated to a robotic surgery research related to training and assessment of the surgical skill. She joined Johns Hopkins as a faculty in 2016 and has served in a variety of roles, including admissions, resident and medical student mentorship, and was recently named the Associate Program Director of the Minimally Invasive Gynecologic Surgery Fellowship. She has a special interest in quality improvement as it relates to surgical outcomes. She commonly treats patients with conditions such as fibroids, endometriosis, ovarian cysts, and pelvic pain. So welcome, ladies, welcome to our conversation today. Thank you for joining us. How are you?
Doing well. Thank you for having us.
Yes, thank you for joining. Thank you for joining. I want to start out because I know that one of the things that persons may be asking on the line is, we have a nurse cardiovascular epidemiologist, and then we have an OB/GYN physician. And how do those intersect as we're talking about women's health, right? And I really want to open up the conversation and invite everybody in to know that health is not just a snapshot. It is over the continuum of our life. And in our planning committee, one of the things I want to share with you ladies is that we talked a lot about fibroids, endometriosis, and then we talked about preeclampsia, right? And the death, the maternal mortality that happens around that. And so we said, well, let's bring these two in, because there is an intersection that happens long before we get to maternal health and preeclampsia. So Dr. Yvonne Commodore-MENSAH, and I'm going to call you, what are we going to go by today? Yvonne or Dr.?
You can call me Yvonne. That works just as well. Okay,
Yvonne. But they do have credentials. I'm just letting everybody out there know that these ladies are credentialed out, okay? So I want to open up with asking, right? Because understanding that women, by the time they get to their maternal age, tell me a little bit about the cardiovascular disease in younger Black women, right? Because I understand that cardiovascular disease that younger women actually have cardiovascular disease, but it may go unnoticed. Can you talk about what that looks like? What are some of the signs and triggers that young women should be looking for as it relates to cardiovascular disease?
Well, thank you so much, Randy. I first have to say that it's such an honor to be in the company of two amazing women that I admire so much. And I'll preface my comments by saying that Reverend Hickman pointed out that no passion, no purpose, right? And one of the things I'm really passionate about is heart disease in Black people, and heart disease in Black women also, because I'm a Black woman. And one of the startling statistics is that heart disease is the leading cause of death in the US and among Black women, right? So about every 38 seconds, someone's wife,
someone's sister, aunt, girlfriend, dies from heart disease, right? And most of this is preventable, right? We know what causes heart disease, and most of it has to do with lifestyle. So there are people who may not be physically active, people who may have hypertension, who may be overweight or obese. But we can't talk about these risk factors, but not also acknowledge the root causes, right? Many Black women live in neighborhoods that don't allow them to be physically active, to get the care they need. There are Black women in this country who don't have health insurance, who don't have health care access, right? So we talk about health behaviors. It's important to be aware of your risk for hypertension. If you have high blood pressure, it's important to monitor it. But I think it's important for us to also move away from the conversation and focus also on the root causes. How do we change the environment to make it easier for everyone and Black women to live longer, healthier lives? So we know that social determinants, the conditions in which we live, play, and work really influence our health. And if there's one thing we've learned in the past year and a half, it's that we need to address these structural causes of health disparities, right? It's not the color of our skin, but it's also the environment in which we live in that raises our risk for heart disease. So yes, and particularly among Black women, as you pointed out, Randy, we know that all women are at risk for heart disease. If you have a heart, you're at risk for heart disease. But we also know that women over the age of 55 have a higher risk for heart disease. So when you hit menopause, right, your risk for heart disease goes up. But there's research that also shows that young women now have heart disease at younger ages because of these underlying risk factors. There are women who have high blood pressure and are not aware that they have high blood pressure because high blood pressure is a silent killer, right? So you can't trust your body to tell you if you have high blood pressure. You need to see a provider who will actually diagnose you with this condition. And if you have high blood pressure, and especially among Black women, we know that hypertension or high blood pressure significantly increases the risk of heart attacks, strokes, kidney disease. So if we are to focus on any risk factor, it's hypertension. And we need to address this risk factor in young Black women who may go undetected, right? Because they generally feel healthy. So I'll stop there and see if my colleague, Dr. Simpson, has anything to add.
Honestly, Yvonne, I don't have anything to add. That was so well said, and I think hit on the key points. I think, Randy, you talked a little bit about where's the intersection. A lot of times the intersection is with race-based disparity, right? So we see a very similar thing with fibroids and Black women being at more risk and more risk at a younger age. And one of the ways that we can empower women is to encourage them to make sure that they're establishing care, right? I always remind people that you don't have to have an issue, just like Yvonne, you don't have to have an issue to see a doctor. A part of seeing a provider of any sort is establishing care for preventive purposes. What am I at risk for, right? Based on how I look, who my family is, and those types of things. And what should I be doing as just a human being, right? As a person. And so really want to encourage women today, if you've not established care with a primary provider or a gynecologist, please do so. You know, it honestly can make a difference in terms of how you're going to live the rest of your life.
Yeah, you both have kind of went straight in, right, and started talking about, you know, the social determinants of health and structural racism and everything. Let me just dive right in. And KHARA, you said one of the things like establishing a relationship with your provider. What are some other best practices that Black girls and women can really use to navigate a system that has historically, right, been set up against them or marginalized or oppressed them?
Yes, absolutely. So I think the first thing is obviously getting referrals, right? From other people within the community, within your family that already have great relationships with medical providers. There's also several resources, and I don't have the name of specific ones, but there's several websites that will actually allow, if you're someone who's interested in seeing a person of color, there's websites that will identify certain providers within your own community so that you can, identify people that look like you, if that's what's going to make you feel more comfortable with establishing care. I think the key is the age, right? So I think a lot of people are like, well, I'm healthy, I'm fine, I don't need to see anybody. I'm like, well, you know, our recommendation from a gynecologic perspective is if you are healthy, right, you don't probably need to see anybody before the age of 21. But I do see patients, and they're brought in by their mothers, their aunts, their cousins to say, hey, this is what this experience may be like. It may be that relative's visits, but just so that they get the experience and understand what it's going to be like for them. So I would say, again, I'll let Yvonne speak to what the recommendations are from an internal medicine side, but definitely from a GYN side at age 21, regardless of whether you're sexually active or not, we advise that you start to engage, right, with a gynecologist at that age. You're on mute, Randy.
I'm sorry. Yeah, look, I mean, we've been doing this for a year and still. But you made the mention, like at 21, you should start engaging. Right before we go over to Yvonne, if a person is sexually active before the age of 21, right, should they be engaging in getting?
Yes, absolutely. Yes, absolutely.
Okay.
Absolutely, right? Once you're sexually active, you increase your risk for potential exposure to not only infection, but HPV, the human papillomavirus, right? Which is one of the main causes of cervical cancer. Again, we still don't advise that we screen for that necessarily, but again, you're exposing yourself. Allow us to talk you through, right? What's safe, what's not safe, and talk you through whether or not you're interested in contraception or birth control. Let us actually engage with you in that conversation.
Fantastic.
And I couldn't agree more about your comments regarding seeing a provider, right? And so one thing I would advocate for is that every woman should get her woman visit every year. Right. And so your body goes through changes, right? And as you age, right, there's some changes that go on throughout your body, and you can't really trust your body or, you know, to alert you. And so you need to see a trained provider who will examine you. There are things you can do at home, right? And I alluded to hypertension. So every Black woman, every woman should own a blood pressure cuff, right? And thankfully, there are affordable cuffs, blood pressure devices that go for less than $50. It's an investment. So if you're going to invest in something this year, if you know you have a family history of heart disease, if you have hypertension, you've been diagnosed with this condition, please invest in a blood pressure device so that you can monitor your condition at home, right? And that will also allow you to engage with your provider to talk about what's going on with your blood pressure when you're not in the provider's office. If your numbers are high and you're on medication, what are some changes that could be made? What are some lifestyle changes you can make in terms of addressing your diet, changing your diets, reducing your intake of sodium, getting more physical activity? There are things you can do at home, but I can't stress enough the importance of seeing a provider every year so that we can actually track what happens and changes in your body.
You bring up something, you both have said it, like, you know, to track the changes, right? Because there are loads of conversations in, you know, through generations and in families, and some things are looked at as normal, right? Because I've had generations who have had fibroids and they've had a hysterectomy, that's just normal. Or my mom had heavy menstruation, and that's normal. How can we begin, so I'm thinking about that as you're saying, you know, develop this relationship, because there's a lot of conversations happening and we think these things are normal because they're normal in our family. I can just remember as a child, you know, as a teenager, right? Young ladies taking off every time that they had their cycle, their menstruation, because they were in so much pain. So it became a thing of like, oh, that's normal, you know? And what is, KHARA, when we're talking about this, like, what is normal when we're talking about reproductive health? And is there a normal, right? Maybe that's a broad question.
So the first thing I always remind people is that no one is created equal. Meaning that I love it that people talk to their friends and their families about their conditions, and you should continue to do that. But your body, your life is not going to always, right, mimic their life and their body. So what might be normal for them may not be normal for you. Okay. So from a bleeding standpoint, from a menstrual period standpoint, right, we would say anybody who has bleeding for longer than 7 days, that would be considered abnormal. Okay. If the interval, so the time between your two periods, is less than 3 weeks or more than 6 weeks, we would consider that to be abnormal. If your period is so painful or so heavy that it stops you from working, sleeping, eating, honestly, anything like that, abnormal, okay? Having mild menstrual cramps, you have to take an ibuprofen or an Advil for, okay, that might be within the realm of normal, but if you are debilitated, you cannot get out of bed, that is not normal. Okay, so I would strongly encourage you to see a provider. And if you see, if other women in your family, you're like, it's normal because it's normal for them, like, it's not normal for them either. So, you know, again, really strongly encourage you to see someone to just go through what the potential causes of those symptoms are.
Yeah, I've been seeing, so in terms of like bleeding, so many women, and last week I talked about being open and vulnerable, you know, in terms of who I am as a person, and I'll be vulnerable with our audience because we are all Black women. Like that happened to me, to get to a point, right, where I was bleeding so much, it became a normalcy, right? And by the time I got to my doctor and I wondered, like, why can't I run so many miles anymore? And I had bled so much, I developed anemia, and it connected to the point where I was starting to have heart palpitations, right? And these things were like leading down. And so it become, you know, I just can't stress it enough because it's so, you know, even through Facebook sharing, and you realize that so many women are having they have these similar stories. Like this is not an isolated story of women going, once we are, you know, once it's too, you know, once we can't handle it anymore, right? We talk about this idea of like being busy. And so how can we make health our priority? Yvonne, like how do we begin to make health our priority? Or Car, I see you go both leaning in.
Right. It's interesting that, Randy, I also share the same experience in terms of having very heavy periods that are painful, sometimes debilitating. And I think there's so much we don't know about how to manage fibroids, and Dr. Simpson can share sort of the late breaking signs in terms of how we improve the quality of lives of Black women, right? Because it is really debilitating, and many of us, myself included, have just accepted that this is something that I have to live with. But like Randy said, we really need to seek care, and I've tried different options and neither work, right? So I'm still exploring options. Dr. Simpson, I'll be in touch with you after the fact. Yes. But to your question, how do we prioritize our health? I think it's important to remember that this is the only body we have, right? And you have one life, and we really need to prioritize our health, right? Our health comes first. Until we take good care of ourselves, we cannot care for others, right? And I think it's really easy. As Black women, we like to be strong. We like to take care of others, put others first. We are mothers, we are cousins, we are aunties. We put all of those relationships first. But I think it's about time, right, that we make our health a priority. And there are simple things that we can do. And one of them is moving more, right? We know that obesity, right, is a risk factor for high blood pressure, and high blood pressure is a risk factor for stroke, you know, heart attacks, etc. So if there's one thing, and when you think about exercise, people feel like, well, I can't go to the gym, I can't get membership. There are things you can do in the comfort and safety of your home, right? There are things around the house you can use. And thank goodness for social media, right? If you have a social media account, follow those fitness gurus, right? There are people that I follow who really make exercise appealing. You watch them and you think, gosh, I've got to get up, I've got to move. Yeah, we need to take advantage of all of those resources and move more and maintain a healthy weight, right? Because doing that reduces our risk for hypertension, heart disease, right? And we also need to watch our diets, right? Our intake of sodium, right? We know that especially among Black people, right, we seem to be very sensitive to salt intake, right? So a higher sodium diet increases the risk for high blood pressure. We need to be mindful of what we eat, right? We need to eat to nourish our bodies, but also know when it's okay to reduce our portion or to stop, right? So those are just a few practical ways that we can take care of our bodies and reduce our risk for heart disease.
I'm glad you brought that up. Like, prioritizing health even begins before you walk into the doctor's office, right? It begins with our things, like, and how do we have some autonomy over our own lives, right? And a lot of things that we talk about are through lifestyle, right? We can think about them in terms of lifestyle, and making time and putting it on your calendar, like booking your time is a lifestyle, right? To make time for you. I did, because, and I do want to tell the audience, like, we're in this discussion, but we want to make this, you are in this discussion as well. And so I have seen comments come up and questions come up. And there was one last question that was directed towards Dr. Simpson, asking about minorities, less minorities being present at gynecologist office, as religious and strict parents believe that going for a checkup involves a child being sexually active. I guess I want to just add to that as you go into that too, KHARA. And talking about legally, when can people come and get vaginal exams on their own, right? Is there a stipulation on that?
So it's not considered a procedure. So if you're someone who is under the age of 18 or under the age of 21, you can still seek care. And remember, this is really important. Because you see a gynecologist does not mean you need a pelvic exam, okay? So I will say the vast majority of patients I see, I don't always do an internal exam on them. So I want to address that from a fear-based thing, because I think some people are very afraid of that exam. For a lot of women, that exam can be quite uncomfortable. Now, there are reasons to do it, but not every visit needs to incorporate that. But we definitely do see a reduction, because people assume that you're seeing a gynecologist because you're sexually active. No. I would say I see women for a variety of reasons, and that's not the only one, but we definitely do see that. But I want to encourage women, again, you do not necessarily need to have a pelvic exam. And importantly, it's your body. A part of my discussion with all my patients is, listen, I do what you are comfortable with. Even before I start to do a physical exam, I actually tell the patient, I say, listen, especially in patients that are concerned about pain, listen, you're always in control. My job, I'm looking for information. At any point that I make you feel uncomfortable, something is painful, I'm going to stop. Do not tell me, oh, it's okay, keep going. No. We stop. We've gathered some information, right? And like I said, you do not always need a pelvic exam. So please don't let that be something that stops you from seeing a provider because you don't want to get the pelvic exam. You always have the right to say no. The provider may tell you, hey, I want to do it for this reason. In terms of testing for infections, as of right now, we're very fortunate. We have a lot of what we call PCR testing, which just means we can get very small amounts of discharge and things like that and actually test it for infection. So now you can test for certain diseases with urine only. You can test diseases with just a swab in the vagina. Mm-hmm. So like, it doesn't require me to do an exam or anything like that. So there are options out there for you if, again, there's a concern about doing the exam itself. So I hope that helps some.
That is very powerful to know. I think, one, knowing that just to go to a gynecologist does not mean a vaginal exam, right? Mm-hmm. And I think when we start to have these conversations, even in my adulthood, right, you realize that women have not been in touch with their bodies and their health, their overall health, because they don't understand what's happening they don't understand what's happening in their reproductive system outside of, unless we're talking about sex. And sometimes, I fear to say it, that men are more versed in our reproductive health system than women. And I don't know if that has come into your office, if people have discussed that, but women that when I've had conversations, when we've had these conversations, mm-hmm. girlfriend to girlfriend, it's like, yeah. Are you looking at yourself? Are you doing, and when we're talking about prioritizing health, doing your own self, just a self-exam of saying, what is everything looking like? Does it look normal, from Monday to Friday?
Right. No, and I have to add that I wish my first encounter with an OBGYN was with someone like Dr. Simpson. And when I was about 12, and my mom took me to see an OB, it was an older Black man who was probably in his 60s. He didn't talk to me. He just said, lay down. And that was really traumatic for me. Mm-hmm. And for years, I feared going to see an OB, right? So I think thinking about the lifespan and younger Black women too, we need to also make sure that, you know, their first experience with an OB is a positive one, right? So they don't shy away from going in to be seen. They don't feel violated, right? So when you talked about fear, I think that struck a chord with me because I've never forgotten that experience. However, the first time I had a Black OB, let me just say that things changed. When she walked in, we both looked at each other and I actually confessed to her, where have you been? Right? I said, and she said, I get that a lot, right? A lot of sisters come into this practice and I walk in and they say, where have you been? Because to the issue of representation, there aren't enough people like Dr. Simpson, right, who are caring for Black women, right? Because we know that there's a difference in comfort level, right? So at the end of the visit, I felt like I had just been chatting with my older sister. I felt comfortable raising any concerns or issues I had. So we need to diversify the healthcare workforce so that we have more Dr. Simpsons, more Black women who are in the healthcare space, right, who are delivering culturally competent care and also are aware of some of these myths and issues that may be culturally situated, right? And so I just have to say that, you know, you really are a role model, and I hope there are young women who are watching today who are inspired by you and decide to follow in your footsteps.
Oh, you're so kind, Yvonne. But you guys are also both superstars, as are all the women that are watching here today, right? We're all just working right within our purpose, right? Within our passion. Yeah. And that's what allows you to, right, be able to do certain things. So I encourage everybody out there that's listening, you know, find your purpose, find your passion, and do your part to contribute to this big, beautiful world. So
yeah, I'm glad you brought that up. Like, you know, the fear of dancing and the, you know, like that fear and how it can travel with us, right? Like talking about that dancing in the face of fear and women having experiences like this. Like, how do we're giving them information, but how do they enter into those spaces feeling so empowered? I mean, to utilize their voice, right? Because you can go into the doctor's office and you could have things written down and then they can give you a look, right? You enter into the system and it kind of just shuts you down. Yeah. And I know, KHARA, you talk about the power of a second opinion.
Yes. Yeah. So what I try to remind people when you're coming in is that you don't have to do anything that the provider recommends. Okay, you're going in to get information for yourself, to empower yourself to be able to make an informed decision. Okay, an informed decision means you've talked to your friends and family, and now you're actually seeking a medical professional to give you the other side, and then they're providing you with information to make a decision for yourself. Okay, so important. And I see someone here, it's like, you're always in control. Absolutely, you are always in control. So, and again, I think this helps with the fear of seeing a provider. Again, they can't do anything to you. You're there for you to get the information that you need that's going to hopefully push you along this trajectory, this journey, or get you to where you want to be. So that's why I remember, they're going to give you information. You get to choose what and what you will not do. Okay, so I feel like that's the best way to go into those visits. And then also, I tell people all the time, when you go to that one visit, you don't have to make a decision. Okay, you're there for information. You don't have to make a decision. I tell people all the time, I can tell by the time we finish the conversation, they're overwhelmed. They're like, I don't know. What are my options again? You know what I do? Here's a packet. Here's the stuff we talked about today. Take some time, talk to your friends and family, connect back with me once you make a decision about what you want to do. Okay, so the important thing is that, right, that one visit, the door's not open or shut on that one visit, right? Meaning that you may decide something that day, and then tomorrow you may be like, you know what, I don't want to do that anymore. And all of those things are okay, and you should seek providers who feel comfortable with that. Okay.
You just gave someone breathing space just now. You just gave someone breathing space right now. Yeah, Yvonne, I saw you come off of mute, and I know that I want to. Taking that, right? And you said even to KHARA, like it's a breath of fresh air to see a Black woman in OBGYN. But even in your work around research, right? And Black persons can be very fearful of research, right? We are very apprehensive of getting into research. Can you talk to, I mean, is it important for us to be involved in research? Even when we talk about hypertension, like when we talk about equity and so, you know, and disparities, especially around cardiovascular disease, some people say some of the standards have been based on white men. So how do we become more involved in the conversation and we get centered, right, in this, in standards of care?
Absolutely, and I couldn't agree more with your comments, Randy. I think representation matters, and when it comes to research, we need to be well represented. And so when you think about the treatments that are developed and the clinical trials that are conducted, right, if we don't participate, right, in these trials, then we actually don't know how well these treatments work in women, and Black women especially, right? I think all of us would feel more comfortable if we knew that, let's say, a trial like the COVID-19 vaccine trials that have very decent representation of Black people, we feel more confident that, okay, they've tested this in Black people and it works well for us, because there are differences, right, in how people respond to treatment. And I think, you know, our hesitancy when it comes to research is well-founded, right? We know that the US has a history of misconduct when it comes to medical practice, but also research. And look no further than Johns Hopkins and the Henrietta Lacks, you know, issue, right? And the HeLac cells and what happened where her cells were used for research, and the medical community benefited from it for decades, right? And so there is a history of misconduct, and so people are hesitant, are fearful, right? And that's why as scientists, researchers, we have to go a step further to ensure that people trust what we're doing. We explain the purpose of the research, the risks, right? The benefits, right? And you don't have to participate in a study if you don't feel comfortable, right? If you're not well informed, you don't have to provide consent. And that's why there are checks and balances now, thankfully, to ensure that people really understand what project or research they are taking part in. They understand the risks, right? And so we know the Tuskegee syphilis study, we know what happened there, right? And Black men not receiving treatment when it was discovered that penicillin was an effective treatment for syphilis, right? So all of these issues contribute to why Black people may not feel comfortable participating in research or even getting a vaccine, right? Because people are hesitant, they're fearful, and that's why we have to go a step further to do our homework and not assume that people trust, you know, the research and the findings, but explain things in lay terms, right? Explain how the research was generated, who's conducting the research, what the benefits are in terms of the societal benefits, but personally, how would people benefit from participating in the study?
Fantastic. Thank you so much. Lady, we have some comments coming in. I know that people were saying this is an amazing panel, great information sharing. I did see one question from Reverend Deborah Hickman. I think she put up a question. So is there a need for us as women and girls to put a spotlight on reproductive justice, given that so many Black women experience preeclampsia, hypertension, and death? And yeah.
I mean, yeah, absolutely. Absolutely. I think that is basically what we've been talking about, honestly, for this past several minutes, is just, again, empowering yourself. Again, you are in control of your body. And then again, that preventive side, which means how do you empower yourself? By actually knowing yourself. Because I do feel like one of the barriers is there's the fear component, right? Oh, do I have to have an exam? What's going to happen? What are they going to tell me? What are they going to tell me that I don't want to hear? Because sometimes people already know. What are the things they're going to tell me that I don't want to hear? You have to lose weight. You need to do this. You need to do these things. But pushing through that, so that, because this is the thing, if you know, you have the opportunity to change. If you don't know, what's going to happen, right? You're going to stay on that trajectory. But yes, absolutely. Reproductive justice is definitely a big topic. And again, the way that we do that is by knowing about ourselves, right? Knowing, seeking care, and then empowering ourselves to make the decision that fits best with our lives, right? And what we want in the future. And again, you should always seek providers who verbalize and respect that about you, right? As a patient. Like I said, you're always in control, and your provider should always appreciate what your perspective is on what they're recommending and try their best to work around. Like sometimes we can't, right? Sometimes there may not be actual medical options that might meet all things, but we should still be able to even say that to you to give you a better understanding. And I saw something else flash across about making sure that you ask questions. Absolutely. The more questions you ask, the better. And again, that is a part of establishing a relationship with the provider. You know what I mean? So that will allow you to understand, hey, are they listening to me? Right? Are they able to answer my questions? So absolutely.
Anything to add to that, Yvonne?
There's very little to add to what the Dr. Simpson said, but I would just say that, you know, for as women, often our value is sort of tied to our ability to reproduce, but women should feel empowered to make that choice to reproduce or not. And if you make that choice, you're still valued and respected, and you're a well-respected member of society if you choose not to bring life into this world, right? And so I think it's important for women to remember that, right? And I really appreciate all the comments you made. And the other thing is that, you know, any decisions that are about our health should be made in collaboration with the provider, right? So shared decision making, it's a concept that's, you know, talked about, you know, in any encounter. Always remember that you're the expert of your body, right? You ultimately make decisions about what's good and what's, you know, what you need as a woman and what will help you to live a longer, healthy life, right? And the provider is the expert in your field, right? So they can give you advice, but like Dr. Simpson said, you don't have to make decisions immediately. You can go back home, ponder on it, and if your intuition tells you, you know what, that's not the right thing to do, right? So sometimes we dismiss our intuition, and you know, women's intuition is often like dismissed as, you know, being over emotional, but that's our power, right? We should use that to our advantage. If something doesn't feel right to you, that gut feeling, don't dismiss it. If you need a second opinion, go get it, right? And feel empowered to do that. And so we need to really own our intuition, right, in making these medical decisions.
I am so glad that you brought that word up. I think language is so important in saying owning your intuition, because sometimes we can leave that out of the equation. But intuition is so important when we are making these, you know, when we're getting all of this information, we're getting data from all points. And as Reverend Hickman put in, autonomy, right? Part of that autonomy is owning that feeling and becoming. And when we're talking about prioritizing our health, it is prioritizing self. I think that when we talk about, you know, great health and things like that, we're actually talking about our whole being, because when we are healthy, I believe we walk through life different, right? We enter into another level of joy. And I think also liberation, because when we talk about autonomy and, you know, this thing of intuition, there's liberation there, like liberation to use your voice. I saw Varna say, you know, sometimes it can be hard to talk about the body, but, you know, once you get there and start talking about it, it is so liberating to be able to walk into an office and say, slow down, I need you to listen to me. Or I'm going to take a few minutes and I'm going to take a week and I'm going to think about that answer that you gave me and what my next step should be. And so many times I feel like women, you know, we feel like, you know, rushed. I have to do X, Y, and Z. I have to do, and we don't have to do anything. You know what we gotta do is be. Let me stop. We just need to be black. we need to be black and be joyful. No. Ladies, I would love to continue the conversation, but as we are winding down on time, and I have you two on the phone, and representation is so important. And as we started off this conversation talking about the history and the social determinants of health and the structural racism. And I'm going to take this opportunity, because both of you work within the Hopkins system. Tell us so we can build more confidence. I think that this is a part of also building more relationship and what is happening on the inside to change the dynamics, moving from provider over patient to patient over provider, and helping to build this relationship so we can get real better outcomes. So what are you seeing happening in the system that you can speak about or share with the community? I see both of y'all shaking your head.
Right. we're both nodding. I mean, honestly, I think an increased focus on recruitment, and not just recruitment of Black and Brown providers, but establishing them in areas that actually will help support the community. And it is definitely different. I actually trained, as you talked about earlier, at Hopkins too. And I will tell you, the face of the providers looks very different, even when I trained. So we're definitely seeing some improvement from that standpoint, and seeing this push. And I think, honestly, the events of the past 2 years have significantly helped with this. There's more, and Yvonne can probably talk about this a little bit more. We're seeing more funding directed towards research, specifically addressing the healthcare disparity. So it's not just about the people that you see. We have to take the time to invest in determining what are going to be the interventions that are going to help reduce, treat the disparity. And we're seeing a lot more funding going into that and a lot more opportunities for that. And I think that is what's long-term going to really help us better treat our patients.
And I can speak to the research space. And for decades, a lot of us who've been in the sort of research space and looking at health disparities have been advocating for studies to understand the effects of racism, structural racism, and many researchers have been dismissed. And it's refreshing that in the past year and a half, there's been a paradigm shift, as KHARA said, where we're seeing more funding opportunities that actually name racism, structural racism, and ask for applications addressing that. And a lot of us think, oh goodness, well, it's about time, right? There's sort of this renewed focus and is branded as this new thing. But I can tell you that people have written about this, have conducted studies about this, and have been shouting from the rooftops. But it seems like finally, at least in the year and a half, because of the death of the killing of George Floyd, right? And the COVID-19 pandemic and, the disparities that we've seen in COVID-19 outcomes, that people are coming around and believing what a lot of researchers have been saying for a while. And so I'm glad that shift has happened, but I think we need to engage more with communities, right? So I see a lot of efforts to engage communities during the COVID-19 pandemic, but when this pandemic leaves at some point, right, we still need to ensure that those resources and services that exist on the ground, right, community health workers that are engaged to conduct contact tracing, we need to ensure that we employ them to address other things such as diabetes, hypertension, right, the other chronic conditions, right? So all of these structures that have been put in place because of the pandemic need to be retained, and we need to build more community capacity, right, to address health and promote health across a lifespan. We don't need to wait for another pandemic, really, to be aware that these disparities are structural in nature.
So I totally agree. Yeah.
So, I mean, we have to continue the work. I'm glad that you hit on that, to continue the work. I wanted to take this opportunity, never to let an opportunity go, that we are informing the community of what's happening on the inside so they can begin to build trust, because on the inside, there are people that look like you and me, right? That are waiting to serve, and to serve from a place of passion and purpose and real authentic engagement, right? And so I don't want persons to be put off because of the larger system, but knowing that there are sisters inside that are helping to dismantle and, refurbish and, just to put better practices and policies and procedures in place. So I really thank you for sharing your wisdom today, for sharing your insight. I think the things that we take away is that self-advocacy and prioritizing one's health is important, even before you get into the doctor's office. But as Dr. Carr Simpson said, making sure that you do have a provider, right? Having someone on your team that is the expert, that is the professional. You can talk to your girlfriends, you can talk to your family, but have someone that you are going to see. And it doesn't have to be when something is not right. You should go when things are okie dokie, when you're not in the midst of the fire. Get to know your provider, because when you get in the midst of the provider, that is not the time to get to know someone, right? We talked about urgent, that boundaries, right? Allowing people to, you can have boundaries, and you can have boundaries, and getting second opinions and things like that, right? And then I might be missing one, the power of a second opinion. The power of a second opinion and your lifestyle choices. When we are talking about health, reproductive health, heart health, there is a common overlay of things that we have to do, but it really takes us individually to be involved. And we do not dismiss the historical trauma that Black women have encountered in health. But we raise that up and say some of the best ways to navigate is to have a relationship with your provider, know that you have a voice and you can breathe and take a moment to step away. And that is where you will become to own your power and then dance in the face of fear. So Yvonne and KHARA, Dr. Commodore-MENSAH, and Dr. Simpson, any parting words before we leave? I really do thank you for your time today.
Honestly,
I just want to.
Go ahead.
I just want to say thank you, really, for inviting us to have this conversation. And I've been inspired also by this conversation, and I encourage women who are listening to really lean into sort of civic engagement opportunities, and the policies are made locally also, right? So I think we really need to be in positions of power and influence, right? So power is one thing, but influence. So where decisions are made about our healthcare, we need representation. We need Black women to lean in, step in, and help lead the charge. So that's all I would say.
Yeah, I mean, same thing. I mean, honestly, this was such a tremendous opportunity. And honestly, as a provider, I don't oftentimes get to have this platform, which I love having, because this is why I'm here, right? I always remind people that my job is actually my job, right? This, though, is the purpose. This is the passion, right? It's being able to share where your gift is from with people, right? And not in an office setting, and hopefully empowering some women today. And just opening the conversation where a lot of people feel uncomfortable. So just, thank you so much, and just excited to see where this goes. Just like Yvonne said, we can't stop here. We have this tremendous door open. We've got to keep pushing.
You muted, Randy.
There we go. Thank you so
That was the best way to end.
the best way to end. Muted. Thank you so much, because I don't have anything to add, because these two women have said everything. Please do, if you want to reach out to them. I do want to ask, if they want to reach out to you, where can they find you, Dr. Commodore-MENSAH?
So I can share my email, and I'll share a link to my profile on our school's website, but folks can reach out to me via email, and I'm happy to continue the conversation.
Fantastic.
Yes, same. I will try to figure out what I can do. Is just same thing. I can send my information over to you guys, and we can share that. Oh, good, you got it there. Okay, perfect. I can add mine there too.
All right. Fantastic. So if you need more information, or you would like to reach out to these young ladies, please do just reach out to the persons here at STAR, and we will share this. But they can also you probably can go to the Hopkins website and look them up. And so thank you all very much. And now we are going to have a special presentation from Miss Doreen VAIL.
Yeah. Said I know that he loves me, yeah. tell you about how much he loves me. Jesus loves me. I said, Jesus loves me. Yeah, yeah. Jesus loves me. Jesus loves me. My Jesus loves me. Jesus loves me. Jesus loves me. Jesus, whether I'm right, whether I'm wrong, he's the same, yes he is. He knows my name, whether I'm lonely, in despair. He never leaves me, no, he's right there in my sin. Oh, he kept me in, saved my soul. He made me whole. Jesus, I'm talking about Jesus. I just love the way he loves me. He made me whole. Jesus, talking about Jesus. He's my friend to the end. I'm never alone, never alone.
Thank you once again for tuning in to Our Womb, Our Love, and Our Power. We will be turning it over to Mr. Demetrius Frazier and Kayla Wolford to give out the prizes and to tell you about what's coming up next week. Thank you all for joining in.
Thank you, Ms. Wood. Good morning, everyone.
Good morning. I'm Kayla Wolford.
And again, I am Demetrius Frazier. And we just want to say thank you to everyone who has joined us on today. Thank you to our special guests and especially our sponsors for today.
We hope everyone enjoyed today's session on women's health. And we thank everyone who was in attendance for our live feed and those who are watching and those who are watching as soon as they get off of work. Thank you so much. We appreciate your dedication and commitment to watching us every Wednesday.
What did you get out of today?
Today, I got that young women really need to start investing into their health. Like, some people, they know it all, so they don't want a doctor in their face telling them that, this is what's wrong with my body, or they don't feel comfortable with a male doctor or just a woman doctor that they recently had to transfer over to, because I know a few friends that has had a primary care doctor since they were had the same primary care doctor since they were 2 years old.
Oh, that's not good.
So it's
because as you age, Sarah Lee ages.
Yes, definitely. So it's people need to be more aware of how their menstrual cycles are working. I did not know that if I have a lot of pain in my, stomach or in my back or just pain, period, on my menstrual, that I can't get up and go to work. I don't know that I need to go see a doctor about that. I just think that it's a regular period.
Yeah, because something might be wrong with Sarah Lee down there.
Yeah.
We're going to call her Sarah Lee. And then also what I learned today was it's like you mentioned, like Randy and the panelists, they had mentioned having a relationship with your doctor. You can choose your doctor. And I want to encourage us men who are on, if you have women in your life, talk to your women about their reproductive health, and women talk to your men about their reproductive health, because they might be having, they might have a penis depression, because the penis does get depressed, and we need to have discussions with each other. Don't just pull them out to play handball, because you want to say, hey, man, you want to play? Oh, no, not today. Something might be wrong with it. Let's go to the doctor and make sure we're okay. All right?
Yes.
All right. So let's remember, everyone, Why Women Cry, every Wednesday, 10 a.m. to 11 a.m. Again, we will be back here next Wednesday. And the last day is July the 28th. And so again, Why Women Cry every Wednesday. Tell your mothers, tell your aunts, tell your grandmothers, your great aunts, your play sister, your cousins, and even your husbands, your boyfriends, and the men on the side. Okay? All right.
Yes. Next week, we have the crowd effect lessons on COVID. We will be having our moderator as Chidima Ivy. eBay. I'm so sorry.
That's my homegirl.
Okay.
Don't mess up her name.
Yes, sir.
All right.
Guest speakers, Dr. Risha Irving. I'm so sorry
It's okay.
about these names.
You want me to read the last one?
Yes.
Okay.
Please.
And Dr. Karen Cutloff. All right.
Dr. Karen Cutloff. We have Entertainment by Lindsay the Celloist. And yes, Doreen VAIL was, I love that video.
That was a good video.
That was very entertaining.
It was very entertaining. It took me back to the jukebox. Remember the jukebox network? That's what that video reminded me of. And I needed a little Jesus this morning.
I think
yes,
I'm a
Jesus
little too
loves
young
me.
to remember the jukebox.
You were probably made from looking at a jukebox video.
Oh,
yeah.
Jeez.
Yes.
So we have our raffle.
We have the raffle. Now, this week, you guys, we had winners on last week, but this week we have one winner, okay? And you have to be present. You have to be present. Sorry for the sound effects in the background. Sorry about that. But you have to be present. So if we call your name, you have to inbox us right now to let us know that you are present, because if you don't, we have to pull another name, all right? And I believe this is $50. And we're going to give it to you.
$50 is on the line.
It's on the line, $50 on the line, and we're going to send it electronically. It's a $50 gift card, not $50 in cash. It's a gift card, all right? And it's going to be sent to you electronically. All right, you ready to pull the first name?
Mm-hmm.
All right, dig in the bag. She digging in the bag, y'all. Yes, Jesus loves me. Yes, that video was hot.
All right, we ready?
We ready?
Mm-hmm.
The name we have on today is Miss Sharon Thomas. Miss Sharon Thomas, okay? Now, your number has to match. Let me read this number. I don't want everybody to call and say, my name's Sharon Thomas. Well, do you have this number? 176-201-2883. Again, that's 176-201-2883. I feel like the 7 p.m. lottery on the news.
Okay.
I'm waiting on that inbox.
In the meantime, while we wait on that inbox, people are asking us about these shirts in these comments.
Yes, people are, but you see the shirt. This is the shirt. I don't want to get up. Go ahead. You go ahead and let me move this ponytail. This ponytail is long today. Go ahead and put it over there. There you go. Why Women Cry? Yes. Model it up. Yeah. I'll give us muscle. Hold on. What does it say? What does it say in the background? I pulled your bra. Didn't mean to. Sorry. Be like the tree of life, grounded and rooted in your purpose and passion, swaying and dancing in the face of fear. Hallelujah. There you go.
Hallelujah.
All right. Miss Sharon, she's not here yet. All right. We're going to the next person. Sorry. We have to go to the next person. Okay. We have to give everybody a chance. All right. Okay. This next name, Cassandra Lewis. Miss Cassandra Lewis. Miss Cassandra Lewis, please send us an inbox. Let us know you're here. You have to be present to win. Miss Cassandra Lewis, put your coffee down if you're at work. Inbox us. Go to the bathroom with your cell phone or something, because you're not supposed to be online. You're supposed to be working. She's probably downstairs cooking breakfast if she's working from home. A little sausage and eggs. Thank you. They love the t-shirt. You like the circle? You like the circle?
I love the circle.
I love the circle.
The circle of life.
Okay. All right, everyone. Okay. So we want to say good night. Well, goodbye. Everyone, create a great day. Have a blessed week and weekend. And again, see you next Wednesday, 10 a.m., same time. Okay. And t-shirts. These t-shirts that you all are commenting saying that you like, they'll be distributed after next week. Okay. You will receive them next week. Nice. The circle of life. All right. Have a great day, everyone. Love you all.